Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health School. Okay, we're here with Mrs. Maneve Simon to teach you the hand washing skill, which is required, one of the 22 skills, which is required by the Health Department and Prometric. We would like to begin. First, she had to make sure that her uniform doesn't touch any part of the sink. Her hands cannot touch any part of the sink. We're going to turn the warm water on. She's going to adjust it for her temperature of comfort. She's going to wet her hands thoroughly. What we need to remember that the state requires that nurses wash their hands for 30 seconds. Her hands are completely wet, no shaking, because we don't want to put germs in the air. She's going to get 2 tablespoons of soap. She's going to start to now gather up a lather on the top surface of her hands and both hands. She's going to interlock her fingers to get the germs in between the fingers. She's going to do the top and the bottom side of her fingers. Now she's going to do each finger individually. She's going to do her thumbs and all her fingers on both hands. Please be advised that remove all your jewelry for this skill. Okay. Now she's going to do her nails, which is she's going to make a circle in the palm of her hand to clean her nails. You can sing Happy Birthday to Me or ABCs twice, and that will fulfill your 30 seconds. Now she's going to wash her wrists, both wrists. And finally, she's going to rinse from the wrist to the fingertips without touching any portion of the sink or the faucet. Finally, she's going to get a paper towel and she's going to pat dry her hands thoroughly. Do not shake, because we don't want to rub to cause irritation to our skin. After completing the skill, she's going to get a dry paper towel and turn the faucet off. Thank you. The skill is completed. Welcome. My name is Nina Justiniano. I'm the Director of Nursing at TIA Allied Health. And I'd like to discuss indirect care, which is one of the 22 skills that you must master and complete to complete your CNA training. Okay. Indirect care is evaluated with each skill. It is explaining to the patient and the resident what is going to be done during the skill. There are certain checkpoints that we must remember. We must greet our resident and address them by name and introduce ourselves. We're going to provide an explanation to the resident about the care before and during. We're going to ask the resident about preferences during the care. We're going to use standard precautions and infectious control measures when providing the care. We're going to ask our resident about comfort or needs during the care and before the care is completed. And we're going to provide the resident with rights during the care, and we're going to provide the resident with safety during the care. Please remember that we must provide comfort, safety, and privacy during all the skills that we do for our resident. Indirect care is the explanation of what we're doing to our residents as we provide the care for them. And always remember, safety, comfort, and privacy are first. Thank you. Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health. And for this video, we're going to be doing one of the 22 skills that's necessary that you master to get your CNA certification. I have Mrs. Maneve Simon here, RN and nurse practitioner. She's going to be our resident patient. I'm going to get her out of the bed and walk her 10 steps. Our equipment is a gait belt we use to get her up and walk, and a chair that she's going to be sitting in. Okay? I'm going to start the skill now.
Come in.
Good morning, Mrs. Smith. How are you?
Good morning. How you doing?
I'm good. My name is Nina. I'm your CNA today, and I'm going to walk you 10 steps. You okay with that?
Yes, that would be great.
Okay, let me wash my hands. I'll be right back. Hand washing required. Let me check your ID, please. All right, I'm going to lock your bed, and we need to touch the curtain for the state boards and provide privacy. Okay. I'm going to raise the head of your bed, okay?
Sure.
Nice to know that you're getting up. I'm going to raise the head of your bed. You're getting up for the first time today, Mrs.
Yes.
So we're going to do it very slowly, and you let me know
That's
how you're
good.
feeling. You good?
Yes.
All right. I'm going to remove your sheet now. Do not shake the linen. I'm going to put my hand behind your back and slowly turn you, how you doing, to the side and dangle you. How you feeling?
Okay.
All right. Let me put your sneakers on. Non-skid footwear. Make sure the sneakers are on. Put your foot in. Cameraman, this is a girt belt. It's applied outside of her clothing. Please put your hands on my shoulder. It's below her breasts. Cameraman, make sure that the tag is on the inside. Pull your girt belt snug but not tight. It does not impede any breathing. How you feeling? Are you comfortable?
Yes.
All right. The belt cannot be hanging. It must look neat. All right. Now, for the prompt, I'm going to tell her on the count of 3, I'm going to stand her and see how she's feeling. Are you ready, Mrs.?
Yes,
on the
I
count of
am.
3. 1, 2, 3. Stand. How are you doing?
I'm doing well.
Very good for the first time. Please, nurses, pay attention to my hand position on the girt belt. I have my hands under like so. I'm going to move her. Mrs. Brown, please move your right foot forward. 1, left foot. 2, right foot. 3, left foot. 4, 5, 6, 7, 8, 9, 10. Please pay attention, nurses, to my leg placement. If she was to get weak or dizzy, I would be able to control her fall with the girt belt in my hands here and my thigh here, and I can guide her to the floor safely. If you stand to the side, the patient will fall and you will fall with the patient. Okay, so we're going to move forward. You're going to turn very slowly, Mrs. Turn slowly. Okay, please feel the back of the chair on your legs. You feel it?
Yes, I do.
Now you ease down very slowly. How you feeling?
Good.
All right, the girt belt is removed. I'm going to give her her core light.
Thank
You okay?
Yes.
If you need anything, call me.
I will. Thank you.
Hand washing required. That is the completion of this skill. Thank you. Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health. This is Mrs. Maneve Simon, RN, nurse practitioner, and she's going to help me with the skill. We're going to do giving the bedpan. Our equipment is as follows. This is called a fracture bedpan. This is used for people who have a broken hip or spinal surgery. This bedpan is your standard bedpan that we use. With bedpans, women use the bedpan to urinate and have a bowel movement, but men only use the bedpan to have a bowel movement. They use a urinal to urinate. For this skill, we need a blue pad. I'm now going to knock on the door. I'm going to introduce myself. I'm going to show you how to apply the bedpan appropriately.
Come in.
Good morning, Mrs. Jones. My name is Nina. How can I help you this morning?
Yes, Irene, I would like to use the bedpan.
Yes, ma'am. Hand washing required. I'm going to lock the bed. I'm going to provide privacy. And don't forget for the state boards to please touch the curtain. You don't need to check the ID for someone that needs a bedpan. They need the bedpan, let's give them the bedpan. Okay, I'm going to bring the bed up just slightly, Mrs. Brown, okay?
Okay.
Okay. Now, it's two techniques I'm going to show you how to apply the bedpan. And I'm going to show you the different bedpans. We need a blue pad to protect our primary sheet. Please, Mrs., could you please bend your knees and lift up for me? Lift, please, Mrs. Lift up. Thank you. The bedpan will slide under like so. Down. Another way to apply the bedpan, lift your hips, Mrs., is to, please turn to the side, Mrs. To place the bedpan, cameraman, like so. The bedpan must be put this way. This is the correct way for comfort. She could roll back onto the pan like so. Now, the use of the fracture bedpan, turn over. The fracture bedpan is used like so. Slide it this way, and she could roll back onto the bedpan. What we need to remember as nurses is this. The bedpan can never go on the bedside stand, ever, or any urinals, okay? You can place your bedpan here or on the floor, okay? For this video, I'm going to use the standard big bedpan. Please lift up, Mrs. I'm going to place this on the floor. Please bend your knees. Both knees, please, Mrs., and lift up. There you go. And down. All right. For this, we need to put the head of the bed up. She needs to be in a sitting position when she's using the bedpan. How you doing there, Mrs. Jones?
Good. I think that's good.
You good?
Yes.
All right. I'm going to give her the toilet paper. Mrs. Jones, the core light. When she's done, she's going to call me, and I'm going to retrieve the bedpan. Okay.
I'm done.
All right. Knock on the door. Are you ready to get off the bedpan?
Yes, I think I'm finished.
Okay. I need you to take the toilet paper. Please wash your hands for me. Okay. What we need to remember, nurses, is that you don't need the bedpan, the gloves to give the bedpan, but you need gloves to retrieve it. So I'm going to get my gloves. Hand washing required. I'm going to put my gloves on. Put up here in my back pocket. All right. I'm going to lower the head of the bed. Nurses, you cannot get the patient off the bedpan with them sitting in an upright position. I'm going to lower the head of your bed, nurses, okay? Okay, 1 second. I'm going to ask you to please bend your knees and lift up. I'm going to take the bedpan and you cover it with your blue pad in one motion. Cover your patient. How you feeling, Mrs. Jones? You okay?
Oh, that's better.
Okay, so now we're going to pretend, empty it in our commode, rinse it out, empty it in our commode, throw your blue pad out, return it to the bedside stand, take our gloves off, discard of our gloves, say hand washing required. How you doing? I'm going to give you the core light. Okay, here's your core light, missus.
Thank you.
I'm going to raise the head of your bed a little bit.
Please.
And I'm going to lower it if I've raised it. And put it in the lowest position. Okay. What we need to remember, points to remember for this skill. The bedpan can never go on the bedside stand, either bedpan. You must have a blue pad under the patient to make sure you don't soil your primary sheet. Hand washing is required at the end of the skill. Do you need anything else, Mrs.?
No.
Would you like your curtain open?
I would like to open.
Okay, I'm going to touch the curtain and open the curtain. That's the end of our skill. Thank you. Welcome. My name is Nina Justiniano. I'm the Director of Nursing at TIA Allied Health. This is Mrs. Maneve Simon, RN, nurse practitioner, and we will be demonstrating changing the bed with someone in it. It's called changing the occupied bed, right? For this procedure, our equipment is a fitted sheet, a top sheet, and a pillowcase. That's all we need for the state boards, right? I'm going to begin with the procedure. I'm going to knock on the door.
Come in.
Good morning, Mrs. Smith. How are you?
Good morning. How are
My
you?
name is Nina, and I came to change your sheets while you're in the bed. Are you okay with that?
Yes.
All right, let me get my supplies, and I'll be right back.
Sure.
I have my supplies. Hand washing required. I'm going to lock the bed and provide privacy. Don't forget to touch the privacy curtain during the state boards. May I please see your ID? All right. So now I'm going to bring your bed up to a working level for me. Okay, Mrs. Smith?
Yes.
Okay. I'm bringing her bed up. And I'm going to lower the head of her bed very slightly. How you doing?
Good.
Like the turn in position video, we are going to cross her arms and we're going to bring her over to me slightly. And section and the bottom. Bring the legs over. Okay. For this video, I'm going to leave the sheet open so you can observe me changing the sheet. Okay. On the count of 3, I'm going to turn you.
Okay.
Ready? 1, 2, 3. Okay. This is our core line. We always start from top to bottom, nurses. We always go from clean to dirty. This is the direction that we go. Keep the sheet away from your uniform. During the state boards, the patient cannot touch this part of the mattress. She must remain on the sheet. You're going to open up your sheet. This is a fitted sheet. Please make sure that the sheet does not touch the floor. Go corner to corner. I'm putting your sheet on the bed, okay, Mrs.?
Okay.
The sheet goes to the bottom, like so. Corner. Now, nurses, pay attention. The clean sheet goes under the dirty sheet. Lift it up, push it under as far as you can get the sheet underneath her. Please be advised that your sheets must be wrinkle-free and smooth as you can get it. Okay, Mrs. Jones, I'm going to turn you back over the bump. I'm going to walk around the side of the bed. I'm going to bring her over. Come over, sir, miss. Just a little bit. A little bit. And cross her legs and bring her over. Now, on the count of 3, I'm going to turn you. You ready?
Sure.
1, 2, 3. Okay. Now, nurses, pay attention. We start at the top. We work our way down. Roll the sheet away from you. Pull the clean sheet out. Okay, Mrs., lay flat. I kept it uncovered so you could see the sheet in the position. But please be advised to keep your patient covered at all times. Please hold the sheet. This is the dirty sheet. This goes in the hamper. Now, the clean sheet, this is a clean one, goes on top. How you doing, Mrs. Jones?
You're doing well.
Do not fan the sheets. Do not shake the linen. You're putting germs in the air. Please, Mrs., please hold this for me. Top. You're going under, and you're going to remove the dirty sheet and keep it away from your uniform and place it in the hamper. Now, I'm going to look at Mrs. Jones. I'm going to line the sheet up. Make sure it's even, both sides. Again, mighty corner. Make sure the sheet is over. It's too much sheet. How you doing, Mrs. Jones? You're going to lift and sweep. Sweep again. Go to this side. Straighten our sheet out nice and neat. Lift again. Sweep. Now the last thing we change is our pillowcase. All right. This is our new pillowcase. I'm going to support her neck and remove the pillow. Now, down. Now what we need to remember as nurses, if there's any zipper or tag on the pillow, it goes inside first, because we don't want this tag or any zippers to injure our patient. I'm going to do that like so. Open up your new pillowcase. Very neatly fold it. Zipper side in first. And your tag. Keep the pillow away from you. Away from your uniform. Your uniform is dirty. One thing we need to understand is that the opening to the pillow goes away from the door. It's about appearances. I'm going to lift her head very gently, and I can place the pillow. If you want to flip your patient's pillow, you can still do it this way without having an opening. Put your head down very gently. All right. I'm going to lower her bed. Lower your bed.
Thank you.
I'm going to raise the head of your bed a little bit.
That's
You
good.
okay? It's good?
Yes.
Okay. Would you like your curtain open or closed?
Close, please.
Okay, I'm going to leave her curtain open, closed. Here's your collat.
Thank you.
Anything else you need?
No.
All right, you done? You okay?
Yes, I'm fine.
All right. That's the end of the skill. Hand washing required at the end of the skill. If you forget something, don't forget to say correction and tell the proctor that what your correction is. Thank you. That's the end of the skill. Welcome. My name is Nina Justiniano. I'm the Director of Nursing at TIA, Allied Health. This is Mrs. Simon, RN, nurse practitioner, and she'll be our patient in this demonstration. We're going to demonstrate from this clinical skill checklist sheet, sideline position or turning and positioning our patient. This is our equipment. We need 3 pillows to keep our patient turned on the side. The purpose for turning and positioning our patient is because we want to prevent any decubitus ulcers, any blood clots, any pneumonia. So our patients must be turned every 2 hours, and I'm going to demonstrate the skill now. First thing you must do is hand washing required. I'm going to wash my hands. I'm going to lock the bed. I'm going to provide privacy. Please be advised that you must touch the privacy curtain during your exam. Mrs. Jones, can I check your ID?
Sure.
That's Mrs. Jones' ID. All right. Next thing I'm going to do is going to raise the bed up to a good working position so I don't hit any injuries. I'm going to lower the head of her bed slightly. Mrs. Jones, I'm lowering the head of your bed.
Okay.
The next thing I'm going to do is going to cross her arms, and I need to bring her closer to me because she's in the middle of the bed. So we're going to bring her over some. Okay. We're going to do the middle. And now we're going to do her legs. Okay. Next, I'm going to tell Mrs. Jones that we must keep her covered. I'm going to turn you on the count of 3. You ready, Mrs. Jones?
Yes.
1, 2, 3. Okay, I'm turning her. Now, the first pillow is placed here in the sacral area. to prevent decubitus. You take your pillow, you push it under your patient or your resident, you fold it in half, you push it under again, and you roll her back onto the pillow. The pillow should not come out. Second thing you must do is Mrs. Jones is laying on her shoulder and it's very uncomfortable. Please take your hand and move Mrs. Jones off her shoulder because she can receive a decubitus on any bony province. The back of her head, her elbows, between her knees. The next pillow is placed between her knee and her ankles. How you feeling, Mrs. Jones? Okay. Okay. This is the position. The knees are not touching and neither is the ankle. The next pillow is placed under Mrs. Jones's elbow, like so, to provide comfort for her elbow. All right. Nurses, stand at the foot of the bed. Make sure that your patient is in good body alignment. Now I'm going to fix her sheet. How you feeling, Mrs. Jones?
I'm feeling wonderful.
Indirect care. We must explain what we're doing at all times. Mrs. Jones, I'm fixing your sheet. Come to the bottom. Make sure your sheet is even on both sides. The sheet must not touch the floor for the state exam. Lift your mattress. Sweep. Again for your mighty corner. Sweep. Come to this side of the bed. How you feeling, Mrs. Jones? Are you okay?
Yes.
All right. Lift. Again. Sweep. Again. Now, I must give Mrs. Jones the core light. Mrs. Jones, here is your core light. I'm going to lower the bed because we must put Miss Jones in the lowest possible position. Would you like your curtain open or closed, Mrs.?
Open, please.
Okay, we're going to open her curtain. I'm going to raise the head of your bed. Are you okay? You're going to breathe better?
Yes.
All right. Just slightly raise the head of her bed. Are you comfortable? Is there anything else I could do for you, Mrs. Jones?
Oh, no, that's wonderful.
All right. Hand washing required. That's the end of the skill. Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health, and I'm here to teach one of the 22 skills that's necessary for you to master as a CNA and get your certificate. Okay? The skill is dressing the weak arm. First, we're going to begin with introducing ourselves, knocking on the door, and offering our resident a choice. Okay? Good morning, Mrs. Jones. My name is Nina. I am your CNA today, and I came to dress you so we could go downstairs to the day room. Okay? Hand washing required. Let me check your ID. All right. So I'm here to offer you a choice. Pick from the two outfits that you would like to wear. Oh, the gray and the blue? Wonderful. That's lovely, and it looks very well on you. Okay? We're going to dress the weak arm. Her left arm is the weak arm, but we must take the gown off the strong arm first because we need slack in order to get the gown off the weak arm. So I'm going to go around the bed. While I'm doing that, I'm going to lock the bed. I'm going to provide privacy. Don't forget to touch the curtain for the state boards. I'm going to raise your head up a little bit. Mrs. Jones. And I'm going to raise the bed up slightly. All right. Now I'm going to take the gown off the strong arm first. Please refer to your skill checklist sheet because it's going to explain that you take the gown off the strong arm first. Now I'm going to go around. And now we're going to take the gown off the weak arm. As you notice, we have slack. I'm going to support the weak arm and very gently take the gown off, keeping her covered. Now, we have our blue shirt, long sleeve, which is buttoned up. We're going to gather the sleeve, and we're going to put the shirt on the weak arm first. How you doing, Mrs. Jones? This is a beautiful shirt. Okay. We put her arm in, keeping her covered. We're going to move her forward and place the shirt under, like so. Now we're going to go to the other side and put in a strong arm. Please make sure the shirt is comfortable for our resident. Now we must button it up completely. So we started our top button and we button her shirt. Make sure it's buttoned completely. Removing our gown. Now, we have to apply our sweatpants. Label in the back. We're going to gather up the leg, like so, line it up, place our foot in. I'm going to walk around the bed. I'm going to place this foot also. Okay, maintaining her privacy, we're going to pull the pants leg up, like so. I'm going to maintain her privacy. I'm going to lower the head of her bed just slightly. I'm lowering the head of your bed, Mrs. This will help me to place her pants. Provide privacy at all times. Turn slightly for me. We're going to turn her over slightly. Right. I'm going to come to this side of the bed and adjust her pants. Very gently. Pull the pants up. You can remove your sheet now. Button. I'm going to go to that side and button. Socks are next. Make sure that you put your socks on properly. Line them up with the toe box. I'm going to make sure the heel is in. Like so. We're going to walk around. We're going to put the other sock on, very gently. Lining the toes up with the toe box. Everything must look neat. We're going to button the shirt. Make sure our shirt is buttoned up properly. Mrs. Jones, I'm going to elevate the head of your bed so you breathe a little better. And I'm going to lower the bed to the lowest position. All right, now we must remove and return all our supplies back to the cabinet. The gown goes in the hamper, dirty clothes hamper, and we must also give her the core light. Here's your core light, Mrs. Jones. Would you like your curtain open Oh, you do? Okay, I'm going to open the curtain for you. You're dressed completely. We're going to take you downstairs to the day room. That is the end of our skill. Thank you. Welcome. My name is Nina Justiniano. I'm the director of TIA Nursing Program. This is Mrs. Maneve Simon. We're going to demonstrate one of the 22 skills, which is emptying the drainage bag. Please be advised that this is our Bible and we follow this each step in this directive of the clinical skill checklist sheet. These are some of the supplies that we need. We need a blue pad, some gloves, 2 alcohol pads, and you need the intake and output sheet to record what drainage that you empty. Now, we're going to knock on the door, introduce ourselves, and say, good afternoon, Miss Jones. My name is Nina, and I'm here to empty your drainage bag. It's at the end of my shift. How are you? She's going to do hand washing required. She's going to put on her gloves. And she's going to check the patient/resident's ID. All right. Next, she's going to place a blue pad on the floor. And she's going to use the graduate to measure. Please be advised that this graduate cannot go on the bedside stand or any bedpans for any reason. She's going to use her graduate. The spout cannot touch any part of the graduate as she empties the drainage bag. The bag can never touch the floor. It must be below the bladder at all times. She's going to empty the drainage bag. Please be advised that the quality of your urine will be in the tubing, not in the bag. This urine is stale, has been here for 8 hours or longer. If you need a urine sample, you will take it from this port. Your nurse should provide you with alcohol pad and a syringe to get the sample from this port. Now she's going to empty. Do not point the spout at your face. Goes in one direction, and every drop of the urine that's in the drainage bag must be empty for the state exam. When all the urine is out of the drainage bag, we're going to close it, use our alcohol pad to go from clean to dirty. So we're going to go inside in one direction, out another alcohol pad for outside in the opposite direction. She's going to pick up all her supplies, return the spout, she's going to take all her supplies and her blue pad to the sink, and she's going to wait for it to stop oscillating. We do not read this holding it up. It must be done on a surface, a flat surface. Now, please be advised, nurses, that each line is 25. We're going in millimeters or cc's. So each line is 25. Okay? How much do we have in the bag? 475. Okay? This is dumped in our commode. Rinsed out and dried. We're going to return the graduate to the bottom where the bedpans and toilet paper is kept. Okay. Miss Simon is going to throw her blue pad in the garbage. She's now going to remove her gloves. Please pay attention to the removal of the gloves. Now, hand washing is required. Please review your hand washing skill. Now, after she does that, this form, your intake and output sheet, must be filled out correctly. She got 475. She will write in the output, which is under urine emesis and diarrhea, the time that she emptied it, and the amount, which is $4.75, and her initials. Do not fill out this paper without washing your hands. Your hands must be washed before you touch this paper. Okay? So she filled out her paper. Hand washing required. Just put her time. $4.75. Circle urine and her initials. As you can see, she put the time, the amount of urine, which is 475 cc's or mLs, and her initials. Okay? This skill is complete. Thank you. Welcome. My name is Nina Justiniano. I'm the Director of Nursing at TIA Allied Health. This is Mrs. Simon, RN, nurse practitioner, and we are going to demonstrate one of the 22 skills that's necessary for you to complete your CNA training and pass your state boards. The skill we're going to practice now is feeding. Cameraman, the equipment that we need is, we need a food and fluid intake and output form. We need a spoon, some water, a bib to cover her clothes, and a snack for her to eat because we are feeding the resident a snack. What we need to remember is we do not stand over our residents or our patients to feed them. It's disrespectful, and if they hyperextend their neck, they can aspirate their food. All right? So now I'm going to say hand washing required. Knock on the door.
Hi, come in.
Good morning, Mrs. Jones. My name is Nina. I came to feed you a snack. Are you okay with that?
Yes, sure.
All right. May I please check your ID? Okay, you're Mrs. Jones. Mrs. Jones, you're not sitting properly in the chair. Could you please sit up for me in the proper position? All right. So you must wash your hands. So we're going to give Mrs. Jones a hand wipe to wash her hands. There you go, Mrs. Now I'm going to place a bib. This is a chuck, but your facility will provide you. We're going to use this as our bib for this demonstration. I'm going to cover her clothes like so. And you're going to sit down and feed her and engage her in pleasant conversation. How are you today?
I'm awesome. And you?
I came to give you your snack. Are you okay?
Yes.
So I'm going to take the cover off of her applesauce. It's her favorite. And we must give her a sip of fluid to moisten her throat to help her swallow. Now, we're going to give you spoon only, no forks for feeding. Take the spoon 3/3 full. How is it, Mrs.?
It's good.
All right. You know, your daughter sent this. They said this was your favorite snack. Ready?
Yes.
Okay. After the 3rd spoonful, we're going to give her a sip of fluid to help her swallow. One more sip of fluid?
Yes, please.
Want some more?
Yes, please.
Okay. Again, the spoon is 2/3 full. Allow her time to swallow her food. Observe her swallowing.
I think that's enough.
Okay, you done?
Yes.
A little sip of fluid. More?
Yes, please. One more sip.
One more sip of fluid. Done?
Good.
When you completed this skill, please remove her bib, clean her mouth. You can do it with the bib. Okay? We can throw this in the garbage. Please observe what Mrs. Jones has eaten. This is your intake and output. So we're going to check here. Snack. She ate quite a bit. I would say 75% of the snack. We're going to check 75%. And her fluids, she drank almost all of it. I'm going to give her 100%. And then you're going to sign your name here. You're going to wash your hands and say, hand washing required. This is your core likenesses. Is there anything else I could do for you?
No.
Okay, so now I'm going to clean up my area. Okay, our supplies. We're going to dispose of it and leave our checklist for our prometric examiner to check. Thank you. That's the end of the skill. Welcome. My name is Nina Justiniano. I'm the Director of Nursing at TIA Allied Health. This is Mrs. Simon, RN, Nurse Practitioner, and we're going to be demonstrating one of the critical skills that's required for you to get your CNA certification. It's one of 20 skills that you must master. But this skill from the state is considered a critical skill. You must do this skill correctly. All right? The equipment that we need is just my 2 fingers and a watch. I suggest that you get a watch with that second hand. All right? So this is how we're going to do this skill. Okay, I'm going to knock on the door.
Come in.
Good morning, Mrs. Smith. How are you?
Good morning. I'm well, and you?
I'm fine. Thank you. I came to do your pulse. Are you okay with that?
Sure.
It's part of your vital signs. Okay? Okay. Could you please place your wrist? You must provide comfort. Hand washing required. I checked her ID. Now, this is part of the comfort. Please place a nice towel underneath her arm. Follow her thumb all the way to here. 1, 2 fingers. And this is her radial pulse. You're going to count it for 1 full minute. The minute is up. I counted 78. Now, what we need to remember for this skill is during this testing for the state boards, the state examiner is going to be taking the pulse on the opposite hand at the same exact time as you're taking the pulse. You must get between 4 beats positive or negative. So if I got an 80 and the state examiner gets an 82, you pass. If I got an 80 and the state examiner gets a 78, you pass. If I got an 80 and the state examiner gets an 86, you fail. This is considered a critical skill. Please be advised that you use these 2 fingers to check for the pulse. Do not use your thumb. If you use your thumb, you're taking your own pulse. So once again, these 2 fingers counted for 1 full minute. My suggestion is that you get a watch with a second hand on it and always count your pulses for 1 full minute. Hand washing required. That's the end of this skill. Thank you. Welcome. My name is Nina Justiniano. I'm the Director of Nurse at TIA Allied Health. This is Mrs. Simon. Nurse practitioner RN, we are going to demonstrate one of the 22 skills that's required for you to pass the state exam. Okay? The skill we're going to demonstrate is respiration. Equipment required is either a watch with a second hand or something to count. You must do the respirations for 1 full minute. Please be advised that do not tell your resident that you're doing the respirations because they're going to stop breathing. Just tell them you're doing the vital signs. Okay? We're going to knock on the door.
Come in.
Good afternoon, Mrs. Jones. How are you?
I'm awesome, and you?
My name is Nina, and I came to do some vital signs for you. Are you okay with that?
Oh, sure.
All right.
Thank you.
Let me wash my hands, and I'll be right with you. Hand washing required. May I please see your ID? Okay. So now I'm going to do some vital signs. I'm going to place your hand, like so, on your chest, and I'm going to count your respiration for 1 full minute. Done. All right. Watch her chest rise and fall is considered 1 breath. Okay. Please remember the normal adult respirations are between 12 and 20. The skill is complete. Hand washing required. We're going to give you your core light.
Thank you.
Thank you. The skill is complete. Welcome. My name is Nina Justiniano. I'm the director of TIA Allied Health. And this is Mrs. Maneve Simon, RN, nurse practitioner. And we're going to demonstrate the catheter care that's required, one of the 22 skills that you must master to get your CNA certification. But before I start the skill, I would like to explain some of the catheters that you're going to be using in your career. Please be advised that only an RN or a doctor can insert a catheter. Your job is to keep the catheter clean. That's what the CNA does. So let us begin with the catheters. Some equipment that we need is a washcloth, a basin with some warm water, soap, gloves, a towel. Okay? These are some of the catheters that you might use in your nursing career, so you need to be aware of them. This is called a Credé catheter. This is used for a man who has an enlarged prostate. If you use a regular catheter, it will not pass. This catheter is a 3-way catheter. If you notice, it has 2 ports. One port is for the drainage bag, and the other port is for the irrigation that's going to irrigate the man's bladder after the procedure called a TURP, transurethral resection. And our final catheter is a straight catheter. It has no balloon. It goes into the bladder. It drains the bladder completely, and that catheter is removed. And now this is our standard Foley catheter. If you notice, it tells you the size. This is a 14 French. They come 0 up to maybe a size 23. And it also tells you how much water needs to be put into the balloon to inflate it. It says 10 milliliters. I'm going to show you how the catheter is kept in the bladder. The nurse or the doctor inserts the solution of sterile water into the bladder, and there is your balloon. This balloon keeps the catheter inside the bladder where it does not slide out. To remove it, you must get a syringe, a 10 cc syringe, like so, and you put it here, and you withdraw all the solution into the the balloon is flat and it slides out without any discomfort for our patient. So now we're going to start our procedure. Okay? Mrs. Simon is going to knock on the door. She's going to introduce herself. She's going to say hand washing required. She's going to check the patient's ID. She's going to provide safety by locking the bed. She's going to provide privacy by closing the privacy curtain. But please be advised that for the state boards, you must touch the curtain to provide privacy. All right? So we're going to proceed. She knocks on the door. Come in.
Good afternoon, Mrs. John. My name is Mrs. Simon. I'm going to be your CNA for today. I need to provide fully care. Is that okay for you?
Yes, it's okay. So she's going to check the ID. She's going to say hand washing required.
John, Mrs. John, hand washing required.
She's going to lock her bed. And she's going to provide privacy.
I'm going to provide privacy for
Okay.
Mrs. John.
Now she has her gloves. For this video, we're using the 4-corner technique. This is your washcloth. You're going to fold it in half, and then you're going to fold it in half again, and that provides you with 4 surfaces of cleaning area. 1, 2, 3, 4. Please be advised that Mrs. Simon is going to put soap, no soap, and soap for this procedure. Mrs. Simon is going to have the patient or resident check the temperature of the water for comfort.
Temperature okay?
It's fine. She may proceed with the catheter care. Please, soap, no soap, and soap. Okay. She's going to put her towel over the resident's perineal area. We always go from clean to dirty. So she's going to start with her inner labia going in a downward from back to front. Mrs. Simon now is raising the head of the bed and the bed to provide comfort so she does not injure herself doing the care. She's going from down, from front to back. Wash. Rinse. Opposite side. Wash. Rinse. And now she must do the outer labias, which requires soap, no soap, and soap. She's going to clean the outside. Wash. Rinse. She's going to go here. Wash. Rinse. Now she's going to clean the catheter. Please be advised, nurses, that infections for catheters are ascendant, which means infection is going to go up into our resident. Mrs. Simon is going to go down. She's going to go around and down 3 inches, being careful not to pull on the catheter. Wash, rinse. Wash, rinse. And once again, wash and rinse. Now she's going to pat dry. It's not necessary to wash the patient's buttocks because she was not laying in urine. But we must leave our patient on a dry pad. So Mrs. Simon is going to get a dry pad, and she's going to change the blue pad.
Put your hands, we're going to turn you.
She's turning her comfortably, and now she's placing the blue pad, a fresh, clean, dry blue pad under our resident patient. Okay, Mrs. Simon is going to walk around her bed, and she's going to remove the dirty pad from this side.
comfortable?
Yes, I'm comfortable. Mrs. Simon now is going to discard her blue pad, her dirty pad. She's going to put any towels and washcloths in our dirty clothes hamper. She's going to empty her basin and dry it out and put it in the appropriate place, which is the bedside stand. Mrs. Simon now is going to remove her gloves, give the patient the core light, ask the patient if she needs anything, and that will be the completion of our skill.
Hand washing required.
She's going to get the core light.
It's the core belt. I'm going to put the light down. Now, Mrs. John, would you like the curtain open or closed?
Open, please.
Okay, that is locked.
That is the end of our skill. Thank you. Welcome. My name is Nina Justiniano. I'm the Director of Nurses of TIA Allied Health. This is our Mrs. Maneve Simon, RN, nurse practitioner. She's going to help me demonstrate one of the 22 skills, which is foot care. For this skill, you need to master for your CNA certificate for New York State. Our equipment cameraman is a towel, washcloth, blue pad, a basin for water, warm, soap, and lotion. The skill goes as follows. I'm going to knock on the door.
Come in.
Good morning, Mrs. Jones. How are you?
I'm awesome. How you doing?
Fine. My name is Nina. I'm your CNA today, and I came to give you some foot care. You okay with that?
Yes, sure.
All right. Hand washing required. Nurses. I'm going to retrieve some warm water from Mrs. Brown. Mrs. Brown is going to check the water for temperature to make sure it's comfortable. There are no gloves used for this skill. Could you please check the temperature of the water?
Nice and warm.
Okay. We're going to put our blue pad on the floor. So. We need our soap, our lotion, and our towel, which we're going to place on the blue pad. All right. Let me take your shoe off. Remember, ladies, for the state boards, we're only washing one foot for the state boards. We're not pushing any cuticles back. We're not shaving down anything like that. We're just doing straight foot care with soap and water. And we proceed. We're going to wet our washcloth. Now, for this skill, I'm going to fold it in half and in half again. That's our four corners, but I'm just going to put soap on one corner. I'm going to lift her foot up, make sure my washcloth is washed, and I'm going to proceed to wash the top of her foot and the bottom of her foot. Now we're going to go between each toe. She got 5 toes, so we're going to go through each toe. Now we're going to rinse. This gives you the opportunity to observe your patient, your resident's foot for any sores or swelling. We're going to place her foot on a towel, a dry towel. Down. And now I'm going to pat dry her foot. Please make sure you go through each toe and dry each toe individually. Make sure her foot is nice and dry. Now for the lotion. Remember, the lotion can warm in the basin. We can warm the lotion on our hands. The main thing we need to remember is not to put lotion between her toes. That can cause a fungus. The lotion goes on the top of her foot and the bottom. Warm it up in your hands, nurses. Place like so. And the bottom, we're going to take off the excess lotion. No lotion between her toes. Dry her foot. Well, now you're going to return her sock. Make sure you get the toe box correct. Put her sock on. And we're going to replace the shoe. How you doing there, Mrs.?
Oh, I feel great.
All right. We're going to empty our basin. Put all our supplies in the appropriate place back into the drawer. We're going to dump our waters. Please put your dirty towels and washcloths in the receptacle, your hamper. Dry it out. And use your towel. Put your lotion, your soap. Please return it. The blue pad will go in the garbage. This is your core light.
Thank you.
Hand washing required. Is there anything that you need, Mrs.?
No, thank you.
All right. Call me if you need me. You have to call.
Will do.
That skill is complete. Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health. This is Mrs. Simon, RN, nurse practitioner, and we're going to demonstrate one of the 22 skills that you must master to complete your course and get your CNA license. The skill we're going to do tonight is oral care and denture care. Cameraman, our equipment is as follows. We need a blue pad to protect her clothing. We need some gloves, a toothbrush, some toothpaste to clean the dentures, a cup of water, an empty cup to spit in. This is a toothache. She doesn't need a toothbrush because she has no teeth. We're going to make sure this is on tight because if she swallows this, the patient gets an aspiration pneumonia. So the first thing I'm going to do is I'm going to knock on the door, introduce myself, explain to the resident what I'm going to do moving forward.
Come in.
Good afternoon, Ms. Jones. How are you?
I'm well, thank you. And you?
My name is Nina. I'm your CNA today, and I came to give you some oral care and clean your dentures. Are you okay with that?
Sure.
All right. Hand washing required. May I please check your ID?
Sure.
Okay. I'm going to make sure that you're in a sitting position. I'm going to put your head up just slightly. Okay. Are you okay?
Yes.
Okay, I'm going to take your dentures to the sink and clean your dentures, and I'll be back to give you some oral care. All right?
Okay.
All right. First thing we need to remember, we place a paper towel on our sink, clean surface. We're going to place our supplies, toothbrush. We're going to put a washcloth to cover the basin because the teeth are slippery. If they were to slip out your hand and hit the sink, they will crack. So we must be mindful of that. We're going to put on our gloves. Like so. Please be advised that this is not the appropriate toothbrush for dentures. Dentures have a special toothbrush. This toothbrush is for natural teeth. If we use this toothbrush on dentures, it's going to scratch the surface of the dentures. Okay? So I suggest that we get a dental toothbrush and some dental scrub. Okay? So we're going to turn our water on. We're going to moisten our teeth and our brush, and we're going to start brushing and give up our little foam with the toothpaste. All around. We're going to rinse it under cool water, not hot water, because we do not want our dentures to warp. We're going to fill our cup with some water, make sure it's clean, put our dentures in, and please make sure that the dental cup has the resident's name and room number. All right, we're going to take this out, clean up our area, throw our washcloth away, pick this up, and return our toothbrush. Mrs., where would you like your teeth to be kept?
At the bedside table, please.
Okay, no problem. We will throw this toothbrush in the garbage. Now, I'm going to cover your gown with a blue pad. This is called a chuck or blue pad. We normally use bibs, but we're going to use this today to make sure our clothes. Now, what we need to remember is that she has no teeth, so we don't have to use toothbrush. All we have to do is give her a sip of water. Spit in the cup. Wet our toothette. Open your mouth. We're going to go around her gums, top and around and around. Some water. Please spit. And remember, we must do her tongue. Tongue, please. A little water. Push it around. Please spit. Okay, how you feeling?
Good.
All right. Now remember, we cleaned the surface of our corners of our mouth with the bib or our blue pad. We take this and we throw all our supplies that we don't need away. She wanted to keep her dentures at the bedside, as she can. All right. Remove our gloves. Hand washing required. Let me give you your core light. That's your core light. Is there anything else you need, Mrs.?
No, thank you so much.
Okay. We have completed our denture skill. Thank you. Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health. This is Mrs. Simon, RN, nurse practitioner, and we're going to demonstrate one of the 22 skills that's necessary for you to master to be able to pass your state exam and get your certification. This skill we're going to be doing is mouth care. Cameraman, our equipment that we need is, we need a toothbrush, toothpaste, 2 cups, one with water, one without, and a pair of gloves. This is called an emesis basin or a kidney basin. This can be used for mouth care also, but it has to be washed out. If you use this appliance, please remember to put a paper towel in it, so this way when your resident spits in it, you can remove the paper towel, throw it in the garbage, and it's easier to clean. But we're not going to use this. Okay? Now, the first thing we need to remember is that we need to knock on the door.
Come in.
Good morning, Mrs. Jones. How are you?
I'm awesome, and you?
My name is Nina. I'm fine, and I came to give you some oral hygiene to brush your teeth. Are you okay with that?
Yes.
Okay, so we're going to do hand washing required. May I please check your ID bed? Okay, all right. I'm going to bring the bed up slightly. And I'm going to make sure she's in a sitting position. between 60 and 90 degrees. Are you comfortable, Mrs.?
Yes, I am.
All right. So now I'm going to cover her clothing and protect it with a chuck. We normally use bibs, but for this video, we're going to use a chuck because it's going to protect her clothing. So we're going to place it over her blouse, like so, to protect her clothing while we brush our teeth. The next thing we're going to do, we're going to apply our gloves. You must wear gloves for this skill. Universal precautions. Next thing we're going to do is we're going to moisten our toothbrush. In a little water. And we're going to apply just a dab of toothpaste. A dab. Okay. Now she's going to rinse her mouth and moisten her mouth. Spit in the cup. And now I'm going to begin to brush her teeth, all surfaces. You're going to go in the back, in the front, all around. Please open, bottom teeth. Okay. A little water to rinse your mouth. One more time. One more. Brush all around. Bottom teeth, all surfaces, the top. Okay, we're gonna rinse one more time. Please spit. The last thing we're gonna do is brush our tongue. Please stick your tongue out, Mrs. 1, 2, 3. When you complete your skill, please clean Mrs. Jones's mouth, the corners of her mouth. Okay. We're going to dispose of this. And we'll throw our toothbrush out. Clean up our area. Take off our gloves. Leave our area clean. Return all your supplies where you got them from. Toothpaste, basin, this is basin. Throw this in the garbage, our gloves. Make sure she has the core light. Hand washing required. That's the end of our skill. Thank you. Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health. This is Mrs. Maneve Simon. We're going to demonstrate the incontinent female skill which is required by Prometric. Right? It's certain supplies that we need. We need a basin, gloves, 2 blue pads, towel, 2 towels, and a washcloth. All right? Mrs. Simon is making her rounds. So she's going to knock on the door, introduce herself, and explain to the patient that she's making her rounds and she came to check her to make sure she's clean and dry. She's going to knock on the door, introduce herself.
Good afternoon, Mrs. John. My name is Maneve Simon. I'm just here to make my round.
She's going to say hand washing required.
And washing required.
And she's going to check the ID.
Mrs. John.
Okay, now she's going to look to see if the patient is clean.
Oh, you're wet, Mrs. John.
The patient is wet, which requires us to change our resident. Okay? So now she's going to she's going to lock the bed, provide privacy. She's going to get some gloves and put them on. And the first thing she's going to do is she's going to raise the bed up very slightly to a good working level for her. Next thing she's going to do is she's going to get a blue pad, and she's going to take the resident patient off the wet pad and put a dry pad. Very gently, we're going to turn Mrs. Jones to remove the wet pad. You okay, Mrs. Jones? Are you comfortable? You must talk to our resident and make sure she's comfortable. All right. So now we have removed the wet pad. I'll come on this side. Okay. And it's replaced with a dry pad. That will go in the garbage. We're going to return our patient to her comfortable position. The next thing, Mrs. Simon is going to get some water, some warm water from the sink. She's going to have the resident check the water temperature to see if it's comfortable. The next thing, Mrs. Simon is going to place her towels on her resident to provide privacy. Okay, now she's going to use the four-corner technique. Again, our four-corner technique is so. We're going to fold our washcloth in half, and again, we're going to fold it again, so we have four corners. She's going to wet it again with soap, no soap, and soap. Okay. Check the water. Okay, it's fine. She's going to wet her washcloth now. Soap, no soap, and soap. What we need to remember is we always go from clean to dirty. So Mrs. Simon is going to clean her inner labia with wash down. And we go rinse down. The opposite side will be wash down and rinse down. Please ignore the catheter for this skill. Again now, she must wash her thighs. Wash, rinse, wash, rinse. Wash, wash, rinse. The other thigh will be wash, rinse. Now we're going to wash our mons pubis with soap, no soap, and soap. We always go from clean to dirty. We go down, top to bottom. Wash, rinse, wash, rinse. Now we're going to pat dry. She has 2 towels at her disposal. We must remember that Mrs. Jones has been laying in urine, so her buttocks needs to be washed properly. Again, we're going to turn Mrs. Jones very gently. Towards me. Mrs. Simon now is going to wash her buttocks. Wash, rinse, and change the pad that she was laying on. So we go from this way, wash, rinse, opposite buttocks, wash, rinse. We're going to pat dry now. And leave her on a dry pad. This is when the pad is changed. How you doing, Miss Jones? Miss Jones, it's okay. We return Miss Jones to the center of the bed, and Mrs. Simon's going to walk around the bed and remove the wet pad. Okay. All towels and equipment will go in the hamper with the soil blue pads. Mrs. Simon now is going to empty her basin. Throw everything in the hamper. Dry her basin out. And return it to the drawer. Next, Mrs. Simon now is going to remove her gloves and say hand washing required. Please pay attention to the removal of the gloves. And her hand washing is required. She's going to return to the bedside and make sure that Mrs. Jones has her core light. We're going to ask Mrs. Jones if she's comfortable. We're going to lower the bed because we rose the bed up. So we're going to lower we're going to lower our bed to the lowest possible position.
Comfortable?
Yep.
Okay, I'm going to lower your bed.
She'll raise her head up just slightly because our resident will breathe better with her head just raised slightly.
Going to raise your head slightly. Is this okay?
Yes, it is.
Okay, awesome. Now, would you like your curtain closed or open?
Open my curtain, please.
Okay.
Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health. This is Mrs. Manine Simon, RN Nurse Practitioner, and we are going to be demonstrating one of the 22 skills that's required that you must master to get your CNA certification. The skill we're going to be doing now is nail care. Cameraman, our equipment. We need a towel, washcloth, orange stick, emery board, soap, lotion, paper towel, and a basin of water. I'm now going to proceed to demonstrate this skill. We're going to knock on the door.
Come in.
Good morning, Mrs. Brown. How are you?
Good morning. I'm well, and you?
I'm fine, thank you. My name is Nina, and I came to give you some nail care. Are you okay with that?
Sure.
All right. Hand washing required. May I please see your ID? All right. Let me get some water, and I'll be right back. Be getting some warm water. Our patient resident is going to check the temperature for the water for comfort. Students, please be advised that with this skill, no gloves are required. We are only washing one hand for the state boards. Mrs., could you please check the temperature of the water to make sure it's comfortable?
Nice and warm.
Okay. Now, for this skill, we are just going to, this is our washcloth. I'm going to fold it in half and in half again to make it square to give us 4 corners, but we're only going to use 1 corner for this skill. I'm going to wet the washcloth. She's going to put her hand in the water. I'm going to put soap. I'm going to wash the top of her hand, part of my hand, her wrist, her thumb. The same way you did in your skill, hand washing skill, we're going to wash each finger. And we're going to rinse. And we're going to rinse. Now, we're going to place her hand on the towel. I'm going to dry her hand. This is called an orange stick. Though it's not orange, That is the proper name for this appliance. You're going to dip it in the water. You're going to go under her nail, and any debris, you're going to take it out, place it so. You're going to do each nail. Go under, 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 and under. All right. Next, we're going to use our emery board to get any jagged edges. We're going to go across one direction, one time. All right. Now we're going to use some lotion. Remember, we want the lotion up in our hands. And we're going to put it on our hand and massage our hand. And rub the lotion into our hands, each finger. We're going to take the excess lotion off, pat it. We completed our nail care video. Okay, I'm going to dump my basin of water, put all my supplies back, give her core light. This is
Thank you.
hand washing required. All right, we put this away. Try it out. These will go in the garbage, and this will go in your drawer. Hand washer required. Skill is complete. Welcome. My name is Nina Justiniano. I'm the Director of Nursing at TIA Allied Health. This is Mrs. Manid Simon, RN, Nurse Practitioner. We're going to demonstrate the partial bed bath, which is one of the 22 skills necessary for you to pass your CNA license. We're using the clinical skill list checklist. We're going to follow this very closely because this is the requirement for the state. Okay? Now, some of the supplies that we need, cameraman, we need a basin, a washcloth, 2 towels, a gown, water, soap, and lotion. Okay. Mrs. Simon now is going to knock on the door, come in, and introduce herself.
Good morning, Mrs. John. My name is Minnie. I'm going to be your CNA today. How was your day?
Fine.
I'm going to provide you a partial bed bath. Is that okay?
Yes, it is. Now, she's going to get a basin of warm water. Okay. And now she's going to check the patient's ID. Hand wash required.
Hand wash required. I just washed my hand.
Exactly. She checked the patient's ID. All right.
Mrs. John.
Mrs. John. Now she's going to get some. She's going to lock the bed to provide safety and pull her curtain to provide privacy, which is required in all health institutions, hospitals, and nursing homes have privacy curtains. So we must provide privacy.
No gloves.
No gloves is required for this skill. For this skill, we're using the 4-corner technique. This is your washcloth. We're going to fold it in half, and then we're going to fold it in half again, which is going to provide us with 4 surfaces to be able to give our residents the partial bed bath. First thing is done is she's going to wash the resident's face. There's no soap on the face. She checked it. Checking the water for temperature. It's fine. Next, she's going to provide a nice towel underneath her head.
I'm going to lift up your head. I'll place a towel there for you. Provide protection for the bed.
cleansing the eyes by using a soap-free washcloth, wiping the eyes from inside the corner to the outside corner. No soap. Wash and rinse. She's going to walk around the bed and do the other eye, which is wash and rinse. She has changed to a clean area of the washcloth. Wash and rinse. Now she's going to pat dry. Coming back again now with the four corner techniques. She's going to remove the gown from one arm. Remember, for the state boards, we only washing one arm because the state examiner is checking for technique.
I'm going to remove your towel.
Yes, she's removing the towel, and she's going to place that towel across the patient resident's chest to provide privacy. Now for our washcloth, you're going to do soap, no soap, and soap. Soap, no soap, and soap. No soap. Now she's going to go under her towel and go wash, top of the hand. Perfect. Now rinse. Once more time. Again, wash, under, and rinse. Under. We're going to pat dry. We're going to assist the resident with turning to the side. I'm going to be her side rail. Come over, Mrs. Jones, very gently. We're going to turn our residents and make sure that they remain covered at all times. She's checking her basin of water to make sure the water is not cold or too soapy. The state examiner will check the temperature of the water. Again, four corner technique, soap, no soap, and soap. Mrs. Simon now is going to wash her back. Wash, rinse, wash, rinse. Now it's time for the back rub. Okay. Pat dry. Remember, we need to put lotion for our back rub, so Mrs. Simon is going to warm the lotion in her hand. In a swimming position, she's going to go 3 times up. 1, 2, 3. She's going to take the excess lotion with the towel off the resident's back. We're going to return the resident to her position, which is prone. Okay. And we're going to change the gown to a clean gown. Keeping the resident covered at all times. She's placing a clean gown on the resident, and she's keeping her covered at all times. All used towels and equipment will be placed in the dirty hamper. Yep, tie. She's going to tie the gown. So that's going in the dirty hamper. Any towels will go in the dirty hamper. She's going to make sure that our patient resident has her core light. We're going to return the bed to the lowest position. This is our core light. Put the bed down. We're going to ask our resident patient about any preferences, whether she wants her curtain open or remain closed.
Open.
All right. We're going to use standard precaution and infectious control measures when providing care. We ask the resident about any comfort. We promote the resident's rights during the care, and we promote the resident's safety during care. She's now going to return all her equipment back to the bedside stand. Dry in the basin.
Here's your nightstand.
That is a nightstand. Everything goes back where it belongs.
In the table.
At the end of the skill, she will say, hand washing required. Cleaning off her table, putting everything back. Things will go in the trash. She would say, hand washing required, and this is the end of the skill. Thank you. Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health. And for this video, we're going to be doing 3 separate skills from this clinical checklist sheet made by Prometric. Right? These are 3 exercises. We're going to exercise the shoulder, the elbow, and the lower extremity. For this skill, please be advised that when the Prometric examiner tells you the left, it's the patient's left, not your left. I'm going to start the skill with Mrs. Simon, RN nurse practitioner. So I'm going to knock on the door.
Come in.
Good morning, Mrs. Jones. How are you? My
Good
name is Nina, and I'm your CNA today. And I came to give you a little exercise into your left shoulder. Are you okay with that?
Yes, absolutely.
All right. Let me wash my hands. I'll be right back. Hand washing required. I'm going to lock the bed, and I'm going to provide privacy. Please be advised, for the state boards, you must touch the privacy curtain. Can I see your ID?
Sure.
This is her ID. She's Mrs. Jones. Okay, I'm going to exercise your arm. This is called passive range of motion. When it's passive range of motion, we do the exercise for the patient or the resident. When it's range of motion, we direct the resident to do the skill. But for this skill, I'm going to do the exercise. First, we start with the shoulder. We're going to support our elbow, and we're going to do repetitions of 3, which is 1. How you feeling, Mrs. Jones?
Oh, great.
2. Are you comfortable, Mrs. Jones?
Yes, I am.
Any pain?
No, no pain.
3. I flex. Now I'm going to abduct her shoulder. 1, I'm supporting her elbow. 2, 3. How are you doing? Are you okay?
Yes.
That is the end of that skill for the shoulder. The next skill I'm going to demonstrate is range of motion to the elbow. And that skill, again, we must do our introduction, knock on the door, introduce ourselves, hand washing required. We're going to lock the bed and we're going to provide privacy and we're going to check the ID and get the patient's permission. All right? So for this skill, I'm going to exercise the elbow. Here we go. 1. You okay, Mrs. Jones?
Yes.
2. You fine?
Yes.
3. Now we must do her wrists. Support her wrists. 1, 2, 3. That is the end of the exercising for the elbow. Repetitions of 3, 3, and 3. Now, for the next skill, I'm going to exercise her lower extremity. Please be advised to keep your patient covered. Providing privacy, we're only exposing the leg that we're exercising. I'm going to support her ankle and her knee, and we're going to go 3. 1. Are you okay, Mrs. Jones?
Yes.
2, 3. Now we're going to bend her knee. 1, 2, 3. How you feeling, Miss Jones? Okay? Now we do her ankle. 1, 2, 3. Are you okay?
Yes.
All right. Now we cover Miss Jones. Stand at the foot of the bed, nurses, and make sure that your patient is straight and in good body alignment. I'm going to fix her pillow a little bit. I'm going to straighten out her sheet. Do not fan the sheets. Make it look neat. And we're going to do our mitered corner. Again, make sure the sheet is even. We're going to lift, sweep. That's our mitered corner. Again, we're going to lift and sweep. Mrs. Jones, would you like your curtain opened? Is there anything I could do for you?
Yes, you can leave it open.
Okay, I'm going to open her curtain. I'm going to provide you with the call light. So if you need me, please call.
Thank you so much.
Okay, would you like your head up just slightly?
Yes, please.
All right, I'm going to raise Mrs. Jones' head up just very slightly. Okay. And if I raise the bed, I'm going to lower the bed into the lowest position. Okay, at the end of the skill, I will say hand washing required. That is the end of the 3 skills. Remember, shoulder, elbow, and lower leg. Pay attention to the proctor who tells you whether it's the left leg or the right leg. Thank you. That's the end of the skill. Welcome. My name is Nina Justiniano. I'm the Director of Nursing of TIA Allied Health. This is Mrs. Manee Simon, RN, nurse practitioner, and we will demonstrate one of the 22 skills that's required for you to pass your CNA state boards. All right? This is the pivot transfer that you must master. Our equipment that we need is a girt belt. We need a wheelchair. And we need footrests. Okay? What we need to remember for this skill is the patient can stand, but she cannot take any steps. I will pivot her into the chair using the girt belt. Knock on the door.
Come in.
Good morning, Mrs. Jones. My name is Nina. I'll be your CNA today. And I came to get you out of bed and into the wheelchair. You okay with that?
Yes.
Okay, let me wash my hands and get my supplies. Hand washing required. We're going to lock our bed for safety. We're going to touch this curtain for the state boards for privacy. May I please check your ID, Ben?
Sure.
Okay, there we go. All right. We said hand washing required. I'm going to raise the head of your bed, okay, Mrs.?
Sure.
She's going to be in a sitting position. I'm going to swing her legs out to the side of the bed. Allow her to sit on the side of the bed to dangle. How are we doing?
Good.
All right. Cameraman, this is our girt belt. is applied around the resident or patient's waist. I'm going to show you how to use it. We're going to remove the sheet like so. I'm going to put my hand behind her back and very gently turn her to the side. How you doing there, Mrs. Jones?
I'm good.
She's going to dangle for a second. We want our patient residents to dangle. I'm going to put her shoes on, her foot. Okay, that's good. And then we're going to put the other shoe on. Okay. This girt belt goes outside of her clothing, below her breasts. Please place your hands on my shoulder, missus. And it goes like so. Okay, cameraman, I'm going to thread the belt through like so. Remember, the tag goes on the inside. It's about appearances. I'm going to put it like so. This cannot hang. We must make it look neat. So we're going to place it like so. Okay, so my hands could fit under. I have control when I pivot her. Let's position our chair properly. On the count of 3, I'm going to lock it. Chair's locked. On the count of 3, I'm going to stand her and pivot her. You ready? Hands on my shoulder. Count of 3. 1, 2, 3. She's in the chair now. How you feeling, Mrs. Jones?
I'm feeling great.
Release your brake. Now, we're going to put the footrest. Be advised, nurses, that this footrest goes on a certain way. You must line it up with these nipples. It will not go on like this. You must turn it to the side, line it up, lift her leg gently, it snaps in. Next. Again, nurses, this footrest will not go on like this. It must be turned to the side, line it up with the nipples, gently lift her leg, snap it in. Make sure your chair is locked. Please remove the girt belt from Mrs. Jones. How you doing there, Mrs. Jones?
I'm doing wonderful.
All right, we take it off, and we give her the call light.
Thank you.
If you need me, please call me.
I will.
I'll be down to take you down to the day room soon.
Oh, great.
Okay, hand washing required. That is the end of that skill. Thank you.